Hello, I'm Gloria Sanders, physical therapist for over 50 years. I'm going to leave it at that. And a retired Army Lieutenant Colonel. I'm going to do a few videos, and I want to discuss things that are of concern to me and things that I think that are not up to snuff in our profession that maybe we can correct and improve on. The first thing, and it really bugs me, is having therapists do straight leg raises. What are we thinking? I have had so many patients that have had back problems after doing straight leg raises from other clinics. So I want to talk about that. It's a very common thing. It's prescribed after total knee procedures, after total hip replacements. Most people who are having total knees and total hip replacements are elderly, and most elderly people have back issues. So why do we want to injure the back? When you do a straight leg raise, and this is showing a straight leg raise actually in two positions. The one on the left and in the middle shows the opposite knee flexed. The one on the right does not. Both of these are bad. The one on the left is a little better because it can stabilize the back, but they're still both bad choices. The first thing in medicine is don't hurt somebody, don't do harm. So let's talk about how we do a straight leg raise. Well, it's done with the muscle called the iliopsoas. Where does it attach? It attaches to the femur 3.5 inches from the ball on the lesser trochanter. And the angle of pull, if a patient is lying on their back, the angle of pull is about 30 to 35 degrees above the plane that they're lying on. So this crazy looking thing is a prototype of a leg. The average leg is maybe 31 to 33 inches long. It weighs about 30 pounds. The thigh, of course, weighs more than the lower leg. So this shows a 2x6 with a foot on the end, two boards on the end. The part to the right is the thigh part, so it's two 10-pound weights attached to each side. And then the lower leg, they're two 2.5-pound weights. So altogether, the entire leg weighs 30 pounds. The other important thing is that the bone, of course, the femur is in the middle of the leg. And the attachment of the iliopsoas is on the lesser trochanter, which is the lower part of the femur, and it's 3.5 inches from the ball. So there is a screw in there with a hook, and this strap is attached to the lesser trochanter of the model. And the pull angle of pull is at 30 degrees. So we're going to see what happens when a person contracts the iliopsoas to lift the leg that weighs 30 pounds. So we put a gauge on here to see how much pull there was that would be analogous to the iliopsoas, and it was 70 pounds. Now, when a muscle contracts, it slides in the middle and it pulls equally at both ends. So our mock shows that in this case, there would be a 70-pound pull on the lumbar spine trying to arch the low back and increase the lumbar lordosis. Now, if a person has stenosis, that is the opposite of what you want to do. And you don't want to pull on the low back anyway. So what are we trying to do with a straight leg raise? Why in the world are we even doing it? Well, the function of the straight leg raise is first you do an isometric contraction of the quadriceps at the knee. And then you contract the iliopsoas muscle and lift the whole leg off of the bed at the hip. Is there another way to strengthen the quadriceps without straining the back? Of course there is. How much strength do you really need in the iliopsoas to advance the leg and gait? 2 pounds, 3 pounds? Why? You want a 70-pound pull when you don't need all that? If the opposite leg is flexed, as I mentioned, in doing the straight leg raise, it does protect the low back somewhat. But, and that's a big but, that's why it's in capital letters, why risk it? So this is showing a short arc quadriceps. This is much better. The only part of the quadriceps that crosses the hip joint is one part, the rectus femoris. That's not a good exercise for the quadriceps. This is much better. My theory on the straight leg raise, forget it. Omit it. Don't do it. Why hurt somebody? I mean, I get back patients from all you sorry therapists doing straight leg raises, but that's not what we should be doing. So think about it. You got 7 years of college. Use your brain. Thank you. This is Gloria Sanders again. I want to thank you for listening to my videos, and I invite your comments. All medicine should be a discussion. And that's how we get better at what we do. We need to be able to explain why we do what we do. There's no one way to do things. So I want to hear from you. I don't know what you're being taught in PT school now. So are your professors master clinicians? Maybe, maybe not. Have they seen patients in the last 15 years? Maybe, maybe not. So I want you to tell me what you're seeing, your new graduates. Tell me what you're seeing in your clinics. Tell me what you like about this. If you disagree with something, I want to hear it. And I'll get back with you. I want a lot of comments, and if I get them, I'll do a video of just responding to comments, because I think medicine should be collaborative, and I think we need to share experiences. And I'm trying to do that with my experience, but I want to hear back from you. So subscribe, like, don't like. Let me hear from you.